3. Knock, knock. My name is Judith Sanchez, and I'm a student nurse at LCC, Lamar Community College, and I'm here to put an NG tube. Is that okay with you? Okay, so then I close the curtain for privacy. I'm gonna wash my hands, and I'm gonna put my gloves, and I do my 2 patient identifiers, and I'm gonna pull the pulse ox to check for pulse and to check the stability of the patient. And so I have a towel on top of his chest or her chest. I already provide some water so she can swallow or he can swallow when we're advancing with the tube. And I have a basin within reach just in case. So I'm gonna ask the patient to blow his nose before we do the procedure, okay? And then I'm gonna wipe the nose, okay, before I do that, okay? And then now I'm gonna measure the NG tube, and I already explained the procedure to the patient. And I have him in a semi-Fowler's position. Okay, so you measure the tube by the tip of the nose back to the tip of nose to the ear lobe, okay, and then down to the xiphoid muscle, and then you add 10 centimeters. Okay, so then you mark the tubing, okay, right here. Okay, so then I'm gonna proceed. So then you lubricate the tubing 3 to 4 inches with room temperature water. Okay, so then you ask the patient to clog in the nose, so you check the right side, then the left side. So the right side is the good side for the tubing. So you instruct the patient to relax and breathe slowly. So I'm gonna insert the tube. Okay, so while you're doing this, instruct the patient to drink water. Okay, drink water and swallow it, and then you check with your pin line, you check the back of the throat for kinks. Okay, so there's no kinks. Okay, so we're good. So you instruct the patient to swallow more water, drink more water and swallow it, so we advance more. Okay, and while you're doing this, you put the head down to the chest. Okay, okay, there you go. And keep giving the patient water so he can swallow it while we're doing this, while he's relaxed and breathing, mouth breathing when you do this. So then when you do that, you check the measurements is all in there, so you check that the NG tube is in placement by ordering x-rays. And now I'm gonna check the pH, and you aspirate the stomach contents to measure gastric pH. Okay. Okay. And then, well, you want to do this so you can check for amount, color, and quality of return. So the pH is good. Okay. Okay, so now you proceed to tape it. So I already cut 3 to 4 inches of the tape. So then you put it on top of the tip of the nose, and you tape it in the opposite way. Okay, then you give enough space for the patient to move his head, and then you tape the tube on his gown. Okay, and then you take this out. Okay. You offer the patient mouth care, and then clean his nose. Okay. Remove everything. You give the patient his call light and the bed down, and you put the rails up, and you ask the patient if he needs anything else, or and then you remove your gloves and do hand washing, and that's it.